Lobe assessment is something that is often neglected with the bedside examination. Today we will discuss on frontal lobe assessment. You see a patient who is awake, oriented and answering questions perfectly. Most of us conclude that higher front limbs are intact. That is the trap. Frontal lobe dysfunction can be profound even with a normal MMSE. The frontal lobe is not about memory. It's about execution, it's about inhibition, it is about behavior. It operates through a frontal subcortical circuits. The dorsolateral prefrontal cortex is concerned with executive function. The orbitofrontal cortex is concerned with behavior and impulse control. The medial frontal cortex is concerned with motivation and inhibition. So damage here produces dysexecutive syndrome, disinhibition and apathy and abulia. These are actually network failures, so you don't get focal neurological deficit and they are often missed in routine examinations. Let's see how we can examine the frontal lobe. Neuropsychological studies consistently show that standard bedside MMSE is insensitive in frontal lobe dysfunction. And executive dysfunction is a major predictor of functional disability, even when memory is preserved. So ask the patient for verbal fluency. Ask the patient to name as many objects as possible, starting with the letter Y or F in a 1 minute. This tests the frontal executive output. Loria's 3-step motor sequence is very simple. It's the fist, edge, palm. You show the patient's fist, edge and palm. Ask the patient, do it once, ask the patient to do it along with you and ask the patient to do it independently. This assesses the motor programming. The go, no go test is very easy. You tap once, ask the patient to tap once. You tap twice, ask the patient not to tap. This tests the inhibitory control. Then comes the abstract thinking, how an apple and orange are similar. A concrete answer such as frontal lobe dysfunction. Apathy is often misdiagnosed and treated as depression. But in frontal lobe disease, the patient lacks initiative, not decreased mood. They don't complain they had a poor mood. They just don't act. So don't rely on formal testing alone. Observe the behavior during the interaction with you. Look for these signs. If there is perseveration, if there are inappropriate jokes or disinhibition, if there is lack of spontaneous speech, there is likely to be frontal lobe dysfunction. And the one powerful trick is that if the patient cannot generate a word but can repeat them, it is frontal, not language cortex. So a normal MMSE doesn't rule out a frontal lobe dysfunction or disease. Execution, not memory, defines the frontal brain. Thank you.